Hello anatomy colleagues, this is Dr. Alsup and I am very excited to begin our discussions of the anatomy of the gastrointestinal system. And we actually began this conversation back towards the beginning of the curriculum when we discussed the pharynx and the esophagus. And now we will focus on the abdomen and the viscera associated with the abdomen. So I can't wait to get started, so let's not delay the fun. Our first area we're going to discuss are the abdominal quadrants and begin to get an understanding of what organs lie within these quadrants. But I always think it is nice to understand the rationale behind why these types of seemingly arbitrary divisions exist. These quadrants really allow an individual to have a quick and easily observable means of gaining a basic understanding of where the abdominal organs are or where potential pathologies or associated pain are located just by observing the umbilicus. This can help guide a clinician as to where to palpate or auscultate or percuss during a physical exam with this basic understanding. And as we are talking quadrants, there are going to be two planes that are needed to create this. You have the trusty median plane that we discussed back in our first session. And this is that vertical plane that passes longitudinally through the midline of the body. And then there is the transumbilical plane. And this is easy to conceptualize by just observing the level of the umbilicus and extending laterally or transversely from there. So this is approximately at the level of the intervertebral discs between L3 and L4. And so there can always be a little bit of variation as to where this is located, but that's the general rule of thumb. So these planes create the four quadrants, and they are named based on their position on the patient. You will have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. Now, we are not going to go through all of the details that are provided here on this image and the text, but this is a really nice reference that you can return to throughout our discussions of abdominal anatomy. We will talk through every single one of these organs throughout our time, and it will be prudent for you to have an understanding of which quadrant or quadrants that organ lies in, but you can come back to this if you are unsure. But one thing I do want to note before moving on is that some organs that are typically associated with the pelvis are actually located in the inferior portions of the abdomen, like the ovaries and the uterine or fallopian tubes. Or pelvic organs in certain states can actually move into the abdomen, like the uterus when it's enlarged or the bladder when it is full. So please return back to this image and this text as a reference throughout our time together. Now, as with most things, there can be further subdivisions, 9 in fact, and we wanted to introduce this here in case you see or hear these in upcoming clinical lectures. We will not ask you specifics of these in anatomy. So there's no median and transumbilical plane used here, but instead there'll be two different sagittal planes and two transverse planes. And these specific sagittal and transverse planes utilized may differ according to clinical specializations, but the naming patterns are pretty standard throughout. So that quadrant system that we discussed first is used for more generalized clinical descriptions, whereas this 9-region system will provide a more detailed and specific understanding of structures, pain presentations, and potential pathologies. So again, no need to memorize this for anatomy, but just in case these come up in some of your clinical lectures, you can refer to this image to get that understanding. And we've already come to our summary slide. This first learning objective is to really begin to familiarize yourself with the quadrant system and to introduce the 9-region system. This learning objective is unique in that we aren't asking you to really memorize this quite yet, but to use this resource as we begin to talk through each one of these structures. And you can add in the understanding of the quadrant designation as we go. Thanks for your time and attention here, and as always, feel free to reach out with any questions.